Dr. Lyon, as a pediatrician, what do you see first in a patient who you may suspect having Duchenne muscular dystrophy?
Yeah. So, I think that's tough, and I think this is something we're going to talk a lot about today. But, unfortunately, a lot of times, we're really picking up Duchenne's as pediatricians, and we're really thinking about that a little bit later in the course sometimes, right? So, your 3-year-olds and your 4-year-olds who are coming in, and they're still doing that Gower sign. They're still trying to push them up a whole lot, to where that's become more of an abnormal thing at that point, right? Not one of those normal developmental pieces. So that's one thing that for a pediatrician just kind of makes you go, oh, I can put these pieces together. I've seen those. I've heard those buzzwords before.
Right.
And it's really easier at that point. I won't say that's even still the very first thing that pediatricians will often kind of, see and do and deal with. But the other thing that we see a whole lot is just parent concerns, right? So a huge proportion of my job is just having parents come in and saying, hey, I'm worried about this. And so it's the parent that comes in and says, hey, I'm really worried that my kid's gait is a little bit different than everybody else in class, or we're out on the playground and we're not climbing on the slide and jumping off of things like all the other kids are. We're not jumping up and down and as excited as our cousin is. And so I think more of the parent concerns and more of some of these classic findings are the things that we're seeing most often as pediatricians. Now, that's not to say those kids haven't had some of the other findings earlier on that maybe we're just not cueing into, or we're jumping into, physical therapies and different things first. But I think those are the first things that we're really seeing and connecting the dots to say, hey, this could be something different. This could be something that's not just a normal variant in our development. Um,
Sure.
so,
No, you're right.
yeah.
Can you, from your experience, can you think of a patient that, um, had diagnosed with DMD later on, but if, thinking back, going back, hey, this is something that I saw before. I could have done this differently.
Yeah, and I think that's one of the hard things, right? Is that these are the kids who you always look at and go, man, hindsight's 2020, right? So did this kid when like I kind of picked him up and he felt a little bit looser when we were working on standing when we were 12 months old, when we were 9 months old, when we were smaller, were we a little bit hypotonic at that visit, right? So that's the kid where mom would kind of gone, well, I feel like maybe we're not taking those steps on our own as early as we could. But then we started doing that a little bit better, maybe 6 months later. And so you thought, oh, okay. And I've certainly had kids that, we've put in physical therapy, because that's a lot of times your logical answer when you're not walking without support, when you're not climbing on your furniture at 18 months old. But that, you just don't see progression out of that like you expect to even still. And it's those kids that you kind of still end up, I think, diagnosing sometimes early on, but it's very easy to then look back and go, oh man, that was a cue, that was a milestone that we missed, that was a checkup where our tone was a little bit lower that maybe we should have picked up on earlier.
So when you see these families, right, like you said, sometimes they may say, "Hey, my kid is not doing as compared to other kids of the same age." What kind of approach do you take? Do you immediately jump on some sort of you know testing or referral process, or do so what kind of approach do you take?
Yeah, and I think a lot of that is really dependent on the whole picture that you're seeing right now. But I think the first thing we jump on a lot as pediatricians is because we see developmental milestones delays for so many different things, is to say, hey, this is going to get better. Hey, let's start with some physical therapy or something like that. But I know you've kind of got an opinion on milestone delays and gross motor delays and things we should be doing with those kids.
Right.
I think there are some things we can be doing differently that don't, to where all roads won't necessarily lead directly to physical therapy. So, Dr. Brandon, from a neurologist side of things, what are you seeing when these kids are first referred to you guys? Or what are things that, if you have a family history and these kids are coming in early, what are the early things and the late things that you guys are seeing that we may not be seeing?
Right. No, I think like you said, if there's a family history, it's easy for us, right? So the family knows that, hey, they bring it up to the pediatrician, and we get the referral. We see them right away, and sometimes we see them as early as 6 months, 7 months, even right after the birth. At those times, you don't really see much in the clinically. but they may have high CK. But the typical referral process or the typical patient that I see is usually there is a delay in the diagnosis, right? By the time they get to us, they already 5, 6 years old. They're already having, like you said, Gower sign weakness. They have already having problems climbing stairs. They have seen multiple other specialists sometimes even before they come to us. They have seen physical therapists, like we're saying, or even sometimes gastroenterologists because they were checked liver enzymes at as part of his routine care visit, and that was known to be high, and they were sent to um, gastroenterologist.
So by the time they get to you, then, it's maybe not all the time, but most of the time, I mean, it's kids who are already having profound delays and quite a bit of workup from a non-neurologic perspective, it sounds like. Yeah.
Exactly. Yep. And that's the most common or most typical scenarios.